Okay, Mr. Lamb, we're just getting started on your surgery here. We're looking in from the back to the front. Right off the bat, we can see this biceps tendon's torn. I'm passing a needle right through the middle of it so we can pass a wire and then a couple sutures to secure it. So this is the first thing that we've identified already. There's a kind of a clear cannula coming in on the left side of the needle grasper. So we'll grab the wire like that, and then we'll load it with a suture. And then we'll do that one more time. Let's see if we can get there. Stay up. There's a good spot right there. We'll feed the wire through once again. And with a little luck, we'll be able to retrieve that on this side of the biceps here. Okay, so now we've got that bicep secured. We're going to go ahead and take a pair of scissors and cut it at its insertion site. Okay. Now the biceps is released. And so next we'll take the shaver and we'll smooth out some of these rough areas inside the joint the best we can here. Some of this is getting into torn rotator cuff. We'll look up and see where I'm shaving here. Here's the torn edge of the cuff, very large tear. We'll look at that in a minute. Let's look down at the labrum here, posterior. Come all the way back. Give that to Kendall, so use two hands. And then, okay, two hands, look right here. Okay, so now we're going to do our best to debride this labrum. We can really see that it's loose and kind of frayed all the way around the joint. Pause, please. Can you, where's the water going? Okay. All right, so we've debrided as much as we can. You've got a lot of arthritis in the joint, and there's really not much more we can do here. We're going to go ahead and stop inside the joint and get a look at the rotator cuff tear in just a minute. Pause, please. Okay, so we've got this very large tear pincher that we've identified here. And here we are coming in from the back. The tendon is just, there's not much left. And what's left is really, really thin. See that? So there's really not good stuff left to repair. Hold the camera, please. We'll reach in from the front and see what we can. And basically, this is it here. Look down. So if we can get an anchor in. Show me the articular. Other way. Try and get this anchored down something like that. Okay, pause please. I need a burr. We've got the first suture anchor in. You can see the sutures coming out of the bone, and we've already passed one stitch, and now we're just going to shuttle the suture back. You'll be able to see as we do that here, and it comes out actually way over here on the right. So we're going to go ahead and tie that one right now, because it's going to give us a good anchor point. Okay. We'll get this tied and show you some more in just a minute. Okay, we're going to try and pass the second stitch. Pull back just a little bit. You can see the first one pull back a little bit more. Let's anchor down this poster aspect, and now we're going to pass through right here. And we'll feed that wire through this time. Okay, we'll keep moving along here and show you some more in a minute. Pause. Okay, so we've placed a second suture anchor in. We're going to spread the sutures apart now and see, push in past them, see what we're going to be able to work with first here. It looks like you want the blue and white one first. Okay, and we'll go ahead and take that. And now we're ready to take a turn to the left suture hook. There we go. And we're going to go ahead and pass this through the cup once again. Thanks. So here's where we're at. And that's where we'd like to be. Okay, pause please. Okay, we're finished with the repair. And again, this tenon is very thin, and but it moves together as a unit, and we've got it anchored down to the bone, so I'm hopeful that that'll give you a bit of pain relief, if nothing else. We're going to go ahead and place our pain pump catheter and get you back to the recovery room in just a few minutes. Good luck to you now. Bye.